Hello, good evening to all the dear students and viewers. Today we are going to start yet another session of Mix Match series. So here is Mix Match, and in Mix Match, as you already know, that we are going to merge many things. There are going to be some MCQ questions, there are some picture-based questions, and sometimes the radiology and also some PYQ questions. So these are the mix match things that we are going to include in this mix match series. So here is the mix match and let's see, this is going to be number 6. So this is number 6, mix match number 6. All right, let's see what we have today. And before that, probably I'll give you a little bit of information, glimpse of who I am. So here is my credentials and you can also look up my credentials using this username RoAqua. So please go ahead and see that. And I have multiple degrees from KNC, Mangalore, PhD from Savita University, MT and MBA from USA, that is from Georgia, USA. And I also have done a certification course in ART, that is Assisted Reproductive Technique from Unacademy, and that is going to train in IVF and ICSI techniques. So this is my credentials. Please go through all this, and this is like, always I have a plan B, plan C. So whenever you are bored with something, you can always lean back on something else, right? So that's the idea. So here I have all these multiple degrees with the solo purpose of, not getting bored with the same type of job. All right, so here we have so here we have the first question. The first question tells you, let me just see if there is anybody who is watching and not able to connect. Let's see. Is there anyone like that who is watching and not able to connect? And okay, hope my audio visuals are fine. And here is the first question. A 54-year-old senior manager. So it's like a scenario. So you have to listen to the story first and then look for the keywords. Okay, so let's see what is a keyword. So here he fell down from the stairs, and then what happens? He is feeling severe pain in the right shoulder region. So right shoulder, you have to remember the keyword. Then he was taken to the emergency OPD, and then on examination, the doctor observed that the officer was sitting on a chair with the arm by his body. Okay, and he was supporting his right elbow. He was supporting his right elbow with his left hand. The inspection of right shoulder revealed loss of its normal rounded contour. Okay, there was loss of rounded contour. So whenever you hear this, what is that is there on the shoulder that gives the rounded contour of the shoulder? You have to start thinking already, because you have the keywords, you have to start thinking. And loss of skin sensation. Oh, we know what it is now, because already we are arriving at the conclusion that there is also cutaneous supply from that particular nerve in the lower half of the deltoid. So here we have even more, better clarity now. Any attempt to perform the active or passive movement was stopped by severe pain in the shoulder. So he was sitting on the chair with the arm by his side of his body, and he was supporting his right elbow with his left hand. So this is what happened. Probably his shoulder was dislocated, and when it dislocated inferiorly, inferior dislocation of the shoulder joint can always damage the axillary nerve, because axillary nerve is related to the surgical neck of the humerus. There are anatomical and surgical neck, and it is related to the surgical neck of the humerus. All right, let me just put this close to me. All right, so there we have. Okay, so he has loss of skin sensation in the lower half of the deltoid region, any attempt to perform active or passive movement was stopped by severe pain in the shoulder. So this is what has happened. Which of the following nerve you think is injured? So we just guessed that it is the axillary nerve, because lower half of the deltoid region, he has also lost the skin sensation, because that is supplied by the upper cutaneous. Upper cutaneous branch supplies this skin region. So here it is not the median, because median does not supply anything in the shoulder region, not the ulnar, it is not the radial, it is the axillary nerve. So here you can see there is axillary nerve. It is near the surgical neck. This is the surgical neck. Okay, you can see the other nerves also. This is the median nerve, which is very closely related to the axillary artery. This is the axillary artery. You can also see the ulnar nerve, which is going towards the medial epicondyle. And you can identify the radial, which could be going at the back, but musculocutaneous is very much, uh, giving branches in the arm region, because it supplies all those muscles in the arm region. All right. So the answer here would be the axillary nerve. All right. So let's see if there is anybody who has answered. Okay. Let me just give a. All right. So here is the next question. The second question says, a 56-year-old, sometimes you have to give attention to the age of the patient also, because sometimes if it is a pediatric patient, it would be different. There would be some epiphysis that is not completely closed. That all that you have to keep in mind. So the age factor is also there. So you have to keep in mind that this is a middle-aged person, 56-year-old man. He comes to the emergency department because of persistent left wrist pain. Okay, left wrist. While moving, morning walking 5 hours ago, he fell forward to the ground and landed on his outstretched hand. So it is called a foosh. Okay, he fell on the outstretched hand. So whenever that happens, the muscle and the structures that are usually affected is the one which is very closely related to the radial. So here is the radial bone, because that is what forms the wrist joint, right? So anything close to the wrist joint. What else is closed? We have anatomical snuff box. Anatomical snuff box is very close to it, and we have some structures which are present within the anatomical snuff box. What are the structures? We have the scaphoid bone that could have been fractured. We have the first metacarpal base. Okay, then we also have cephalic vein, and then we have radial artery. So all these are the structures that are present in the anatomical snuff box. So it's very clearly mentioned that there is a tenderness present over the anatomical snuff box that very clearly indicates that there is a fracture of the scaphoid. So here this patient is at greater risk for developing which of the following complications? Because of the way the blood supply is, it has a retrograde blood supply. The scaphoid has retrograde blood supply. So here there are high chances that it would undergo avascular necrosis and later on even turn into osteoarthritis. Okay, so these are the two complications. Since osteoarthritis is not mentioned here, you have to remember the first thing that you can think of is avascular necrosis. Okay, so that is one thing. Carpal tunnel syndrome is affecting the median nerve. Compartment syndrome is completely different. It is with the deep fascia. And diputerin's contracture, it is also completely different. It is also affects the wrist, but that has got nothing to do with this. That has got something to do with the tendons. So here what we are talking about is the scaphoid bone and it is avascular necrosis. All right, let's see the explanation here. We have the scaphoid tubercle, the vessels, that is 20% supplies this. Dorsal ridge vessels, they supply about 80%. There is a distal pole, proximal pole, and waist part of the scaphoid. So it more or less looks like a peanut, right? Looks like a peanut. And this is the bone that is present in the anatomical snuff box. So this is where the anatomical snuff box is. And this is the region, anatomical snuff box. The boundaries of the anatomical snuff box, if you consider, it will be a lonely tendon. So what is that lonely tendon? It is extensor. Okay, extensor carpi. Extensor longus. Extensor carpi radialis longus. One second. There is abductor and there is flexor and there is also the extensor. Okay, extensor carpi, that is longus, is the one which is a lonely tendon and that is present on the one side, that is there are two on the other side. So that is the boundary of the anatomical snuff box. So we'll see what are the other things that you can identify. There could be bruising, swelling, and also pain in the anatomical snuff box. Other than later on, it can also result in avascular necrosis of the region. All right. So here there is little more information on the scaphoid fractures. It is very common because whenever a person falls on the outstretched hand, you can see this is the tendon that is present, that is medially present. There is laterally two tendons. Okay, the depression is called anatomical snuff box. This is a single tendon. Okay, so now there is also many other complications. There could be non-union of the scaphoid bone, or it could be delayed union or osteonecrosis, and also delayed osteoarthritis have been shown to result from this particular scaphoid fracture. So that is all because of the retrograde blood supply. It is in retrograde direction. It's in the opposite direction. And the first clinical sign the patient would experience is tenderness and pain in the anatomical snuff box. All right. So now here, the next one we'll move to. The next one is a male infant was born with very small mandible. All right. A small mandible. It is micrognathia and reduced malar prominence. The maxilla region, there is reduced prominence and down slanting palpebral fissure. The palpebral fissure is down slanting. It is not like almond shaped, it is down slanting. And you can also see there is formation of external ear is also not proper. Probably it is not present and it is malformed. And what do you think is the diagnosis in your observation? What do you think is wrong? So is it Pierre syndrome? Is it DiGeorge syndrome? Teacher, it should be R here. Teacher Collins syndrome or none of the above. What do you think? Which one affects this set of things? So first of all, here when you see the mandible, as soon as you see the mandible, you should be, immediately considering one thing, that is the mandibulofacial. Okay. There is a malformation of facial and the mandible. Mandible is something that is, included here because micrognathia is mentioned. So you have to remember all these are the defects from the first arch. So first arch syndrome, whichever is first arch syndrome, you have to keep in mind. It is DiGeorge syndrome and Treacher Collins syndrome, none of the above. So we have to keep all these things. Let's see what is it. Okay, so here it is the Pierre-Robin malformation. We'll give you more information on this. It's a congenital condition of facial abnormalities in human. It's not just the mandible. There are other things also involved. So here it is a sequence. It's a chain of certain developmental malformations. So here one after the other it starts. Now the patient could also have a retrognathia, that is regressed mandible or absence of mandible. It could also have cleft palate, and it could also include the cleft lip and glossoptosis, that is airway obstruction. So whenever such a patient comes to you, your main, more than any other cosmetic changes, your main aim should be to prevent the obstruction of the tongue, you know, or move the tongue away from the airway so that the airway is not obstructed. It keeps falling back because of the mandible is absent or it is small, and almost all the muscles of the tongue are attached to the mandible. Since that is not happening, the tongue is not positioned properly. So that is the reason the tongue base keeps, moving from shifting, and it keeps obstructing the airway. So this is what happens in Pierre-Robin syndrome. And DiGeorge syndrome, what happens? They have not mentioned anything about the heart defects. So did they tell anything about the heart defects? No. So this is not the case, but these are the features of the DiGeorge syndrome. So there is immunity deficit also, speech and learning disabilities you can see, and typical facial features defect you can see. There is also multidisciplinary approach is essential for this kind of syndromes, where evaluation and management in patient is very, very important to come to the conclusion that this is the thing that has happened. All right. So the patient main thing is congenital heart defect. So that is something that is not present in other things. So now here there is another one, Treacher-Collins syndrome, here mandibulofacial dystosis. So here also you can see dominant, autosomal dominancy you can see. There is 40% will have family history of such a syndrome. 60% are some new mutations that could have happened. So here this gene is found on chromosome 5q, and triacal gene it is called, and that is what gets mutated. And this is the malformation of both the first and the second brachial arches. All right. So here it is first and second arch. So here you can see malformed ossicles you can see, and auricular deformity also you can see. There in that particular thing, it was very clearly given there is deformity of the ear. So you have to remember the answer was Treacher-Collins, because they very clearly mentioned about the auricular deformity, and they also talked about the mandibular hypognathia or hypoplasia, malar hypoplasia they talked about, and they also talked about the absence of mandible or hypo or micrognathia. So, and they also talked about coloboma of the lower eyelids, and they also talked about palpebral fissure. All this was talked about, and this is a typical feature of Treacher-Collins syndrome, and the face would look something similar to the bird's face. All right, so that is the Treacher-Collins syndrome. I'll give you a little more information about Pierre-Robin syndrome. So how it happens, what are the causes, what are the symptoms, and even what is the treatment plan, all that we can discuss. All right. So here we have the next question, that is a 34-year-old male. A 34-year-old male with a squamous cell carcinoma. He undergoes surgical neck dissection while attempting to ligate the superior thyroid artery. So they are trying to ligate the superior thyroid artery. So you should remember superior thyroid artery supplies the upper pole of the thyroid gland. Okay, the surgeon accidentally, there are high chances that he can damage a nerve that lies very close to it. That is, it is always accompanied by a nerve by name external laryngeal nerve. Okay, So only external laryngeal will move away when it is very close to the laryngeal region because it has to go supply the muscle cricothyroid. Supplies the muscle cricothyroid. Until then, it is very close to the superior thyroid artery. So it is close to the superior thyroid artery, but when it comes to the upper pole of the thyroid gland, it moves away. So the best place to ligate the artery is near the upper pole of the thyroid gland. So, okay, so which of the following nerves was most likely to damage? So probably instead of ligating it very close to the upper pole, he went to ligate it somewhere else. That's the reason. So external laryngeal nerve is damaged and there is also recurrent laryngeal that is accompanying another vessel that is inferior thyroid artery. And there is ansa cervicalis. What is ansa cervicalis? Ansa cervicalis supplies the infrahyoid muscles. And this is by the cervical plexus and the 12th cranial nerve. That is a hypoglossal nerve root. So that's how the ansa is formed. This is formed by superior root, inferior root, and superior root is formed by the C1 and the hypoglossal. And the C2, C3 give rise to the inferior root. And together they form a loop that supplies the infrahyoid muscles. And we also have hypoglossal nerve which supplies the tongue muscles, except one muscle. Anyone has an idea what is the muscle that is not supplied? That it supplies all the muscles except one, that is palatoglossus. So it doesn't supply palatoglossus. Okay, this palatoglossus is supplied by the pharyngeal plexus. Okay, so it is supplied by pharyngeal plexus. Let's see. Okay, next one. So here the picture is also there. So you can get a better idea. There is superior thyroid artery. You can identify the superior thyroid artery. And please identify the nerve, external laryngeal nerve. See how close it is to the superior thyroid artery throughout its course. And only when it is very much close to its destination, that is cricothyroid muscle, it moves away from the artery. And that is the time when you are ready to ligate the superior thyroid artery. So it should be ligated close to the upper pole of thyroid gland. The ligation should be done close to the upper pole. So ligate, where you have to ligate. All right. Next question says, a soldier, we're talking about a soldier, he received a wound in the neck. So the wound was in the neck region. Okay. So we are talking about the wound in the neck region. And he recently, that happened during a physical examination. What happened is, it was noticed that whenever he blew his nose or sneezed, the skin above the right clavicle would just bulge upwards. Okay, skin would just bulge upwards. And it indicated that there was something that was filling up the air in that region. Okay, it was filling with the air in that region. It's not the lungs, it's something else that was getting filled up. Probably it was punctured. The upward bulging of the skin could be explained by, why do you think it was bulged? You should remember the neck apex of the cervical portion of the lung extends beyond the first rib. So it passes the first rib, it extends upwards above the clavicle. So you have to remember that. And is it injury to the cervical pleura? Is it injury to the suprapleural membrane? Is it damage to the deep fascia in the root of the neck, or united fracture of the first rib? Ununited fracture of the first rib. What do you think is the answer? Anyone? So we have Abdul, what do you think is the answer? Hey Abdul, what do you think is the answer? So injury to cervical pleura. No, cervical pleura injury would have made the lungs to collapse. So that is different case. Completely it would have been a different case. Damage to deep fascia in the root of the neck. That would not have anything to do with the blowing up of the skin above the right clavicle. So it is bulged upwards. So there is something that is filling upwards, but it is not completely getting into the head and neck region. So ununited fracture of the first rib. So if it was first rib fracture, then all other structures would have been damaged, including the subclavian vessels. So it is not the rib fracture. What is it could be? So here you know that there is something called Simpson's fascia. It's also called suprapleural membrane. So suprapleural membrane separates the lung. The lung apex of the lung would be here, and it has all other important structures. The neck in this portion that is outside the suprapleural membrane. So it's a flat. What is this Simpson's fascia or suprapleural membrane? So that is actually it's a flat dome-shaped structure. It lies in the oblique plane of the thoracic inlet, and it extends from the transverse process of C7 and it goes along the inner border of the first rib. So it is like a tent-shaped structure. So here lying on it are the subclavian vessels and other structures in the root of the neck. So that is not damaged. It is only the Simpson's fascia is damaged, because if there was a fracture of the first rib, all these structures would have got damaged. But that is not the case here. It's only the suprapleural membrane which is damaged. And that's why whenever he blew the balloon, the right side clavicle showed a bump because of filling up of air in that region. Okay, so that is what happened here. So remember, suprapleural membrane is what is damaged. Okay, next question. 15-year-old boy, he developed a severe cold. 3 days later, what happened? His general condition just got deteriorated. He very febrile and started to cough a blood-stained sputum. And later when he coughed, he experienced very much pain in the right fifth intercostal space. So we have to remember right fifth intercostal space in the mid-clavicular line. So what do you think, statement would explain patient signs and symptoms except which one? Except we have to find which one does not fit in. Which one does not fit in? All the other statements are correct. The patient had developed lobar pneumonia and pleurisy in the right lung. Or is it the disease of the lung does not cause pain until the parietal pleura is involved? The pneumonia was located in the right middle lobe. The visceral pleura is innervated by autonomic nerves that contain pain fibers. So what is the thing? He developed severe cold and became very febrile and started to cough up blood. He started to cough up blood, and later when he coughed, he experienced pain in the fifth intercostal space in the mid-clavicular line. Okay, following statements would explain patient's signs and symptoms, except which one? Okay, so the patient had developed lobar pneumonia. So that is, and pleurisy in the right lung. That is correct. So disease of the lung does not cause pain until parietal pleura is involved, because it is supplied by the parietal pleura, it's supplied by phrenic. So that is also correct. So the pneumonia was located in the right middle lobe. Correct. The visceral pleura is innervated by autonomic nerves that contain pain fibers. So that is not true. So it is the D that is the answer. The answer is D. Okay, let's move to the next one. Here, I promised you that I would be telling you a little more information on Pierre-Robin syndrome. So what is Pierre-Robin syndrome? Here you can see the very clearly what has happened to the mandible. Absence or regression of the mandible. It's a condition in which the infant has the unusual, very small jaw and tongue that keeps falling back and, makes the breathing very difficult because the tongue attachments are the mandible. So mandible tongue muscles are attached. There are longitudinal muscles and there are also the transverse muscles. They're called the intrinsic muscles and there are extrinsic muscles. Extrinsic muscles of the tongue are also four of them. All these have one point or the other, either the insertion or the origin from the tongue. So what happens is when the on the mandible, whenever the mandible itself is absent, it becomes difficult for the tongue to maintain the symmetry. So it keeps falling back and obstructing the airway. So here the causes is unknown. It is believed that it is caused by failure of the lower jaw to develop before the birth itself. So here about 7 to 10 weeks of gestation, you see the lower jaw, the mandible, the TM joint. About 14th week, it develops. Okay, so here it does not happen properly, then the tongue may hinder and closure of the palate will cause cleft palate because tongue is supposed to come down and result in closure of the plates, the palatal plates. When the tongue doesn't depress down, then it results in tongue is supposed to depress down and only then the hard palate can close in the center, forming a hard palate. When this does not happen, it results in a gap formation and that is going to cause the cleft palate. So here you can see the soft palate also is got a cleft and high arched palate you can see, and you can also identify the opening in the roof of the mouth causing choking and jaw that is abnormally small, that is called micrognathia, and jaw placed abnormally far back in the throat itself. It is not developed, it is way back in the throat. And downward displacement of the tongue, that is glossotosis, because genioglossus will help in retraction. Sorry, it will help in protrusion of the tongue. And it is attached to the body of the mandible. When the mandible itself is not developed properly, the genioglossus, which is the key muscle in protrusion and depression of the tongue, does not work. So that helps in glossotosis. And the tongue is also very large comparatively, and the teeth is also malformed, and there are always a chance of ear infection because of the abnormally developed pharynx and nasopharynx and the oropharynx regions. So this is the diagnosis, and here 1 in 8,000 newborns are born with such conditions, and diagnosis, a newborn is through physical examination, one can easily make out, everything is seen very clearly, so it is easy to make out. So here you can see that the treatment could be to place the baby in the supine position. And the first thing is to clear the airway. It is so that the obstructed airway is cleared and baby breathes properly. And feeding must be done very carefully to avoid any choking and breathing liquids into the lungs or airways. And child may also be fed through a nasogastric tube to prevent any choking. And in some cases, tracheostomy also must be performed. So all these are some of the things that one needs to keep in mind when one has a baby with such a condition. So this is something that we have discussed today. A lot of things we discussed. And here is my profile. If you want to, follow me, find more things like that, you can also join my Telegram. It's Anatomy by Dr. Rohini, where I have observed that many people understand whenever they have questions. So when you have some doubt in your mind, please do post your questions on my Telegram. I would be answering, taking up your questions personally and answering it. And here you can see my profile. This is how you can go visit my profile and also follow my profile, please. And also see the dedications that students have given. And there are some dedications on the Teachers' Day. And thanks to all those who have dedicated those beautiful hats. And each one is worth $1,000,000. Thank you so much. And here is the Telegram channel where you can access all other PDF notes. Let's crack NEET PG. And you can also see There is Iconic and Plus subscriptions. Iconic will give you actually the Unacademy plus the prep ladder access. And plus will give you the Unacademy access. All the fast-paced, educators will teach you. Not just teach you, they will also give you personal guidance and expert guidelines you'll get, and you'll also get the study material. There is already, countdown started. It is the day 5th. You have just 4, 3, 2, 1 to go, and you will be, losing the access to such a thing, that is to get a hard copy of the notes. So please go ahead, do your subscription. Just today itself you can try this. It's just 5 days over, and you have just countdown, that is 4, 3, 2, 1 remaining. So please go ahead, do your subscription. So if you have any questions, you can always ask, clip and send the question. We'll answer your question. And you also have this. This is what I was talking about. You have just 5 days left. You have free Unacademy printed notes that you can get with a plus subscription. So please, this is valid only till 11th of September. Just see, today is already, you have the day, today is 6th. So you have how many days left? Just you yourself count and see whether you want to be the one to receive the free printed notes, or you want to be just, losing this big opportunity. Just go ahead, subscribe, and it is really worth it. And here are the special classes. We have many special classes that is lined up. I have my special class starting tomorrow at 7:30. So I have 7:30 class with the vagus nerve, and I'm going to discuss all the vagus nerve codes and the branches, and also the MCQs. These MCQs, for God's sake, are going to be really, really good. And there is 6 p.m. class, and I also have one little later, that is at 9 a.m. So these are the classes. Here we have some MCQs again, and here we have glossopharyngeal nerve. And here MCQs will be also on the histology, because there are so many questions that people don't bother to read from histology section. So histology slides, how do you identify? So when you know the normal, only then you can learn the abnormal things in the pathology, right? So you need to learn some normal slides. So that is histology slides MCQ. So please go ahead and register yourselves for all these classes, 7:30, 6 and 8 p.m. So if you are someone who is new to this, please note that you can go to Unacademy Learners app, download it from the Google Store or the Play Store, or on the when on iPhone you can download this. Once you download, you please go to the section where you have competitive exams. Okay, you can click on the NEET PG, and then you can look for my class, that is Dr. Rohini. Okay, it says Rohini Avadhani. So click on that, and you please enter my code. It is ROHINI 10. Absolutely no gap in between. Just enter it in one line, Rohini 10. So when you do so, you will be just welcome to the class, and you will be notified whenever the class starts. So that's how your journey begins with my classes from anatomy. So here is the code entry. This is called unlock code. So this is a must when you are a newcomer. So please use the code, join the class. You can register for the class, enroll for the class, and you will get the notification when the class begins. So you will be counted as one of my learners, and you will have a pleasant journey ahead. And these are some of the features from the special class. You have a very interactive live classes compared to YouTube classes. And we can also use polls. You have a raise the hand feature. You'll never miss a class because it is always notified. And there are lecture notes that you can get in the PDF form. But with the subscription, you can get the printed copy itself, not just the soft copy. And anytime, anywhere, you can access these classes. This is the best feature I have seen, because you don't have to rush home to access your laptop. You can just watch it on your phone itself. And you could be traveling, you could be on your way home. You can just turn it on anywhere you are. These are some of the steps to subscription. And you can also see that if you have a NEET PG in your mind, that is what you want to take up, then you can go for plus, and you can also try the iconic subscription, whichever you think is best for you. You can choose the number of months and go ahead for the payment. And you can install the app in this manner, Unacademy Learners app. And there is the feature called Bugs Bounty, which is going to give you the opportunity to report any inappropriate content. And these are some of the features that we have. You please subscribe and like and share with all your friends and community so that everyone is aware of such good learning platforms. And we urge you to download the PDF after the class from the special classes. And this is the code ROHINI10. So you can just, remember this is the code and absolutely no gap. All right, that is the referral code. And get 10% off whenever you have subscribed. So that is another best part. You can get 10% discount with this. And you also see there is plus subscription, iconic, and you can also see some of the batches have started. And there is also 1 month package. Various things are there in 1 month package. Please try this. And there is also 25,000 plus clinical questions you can access when you subscribe. So there is also boost your medical PG preparation with 12+2 offer. And if you want to have a good foundation, you should go for 4-year subscription. So that is 60,000 and 75 if it is iconic. It's going to give you a good transition from UG level to PG level. So how nicely you will understand the basics if you have 4-year subscription. This is the EMI option in case you don't want to shell out so much money. If you think, then there is EMI option. Even 10, 15,000 is more for you. Go with the EMI option and go pay very little amount, as little as 1250 per month. So that is with the plus, and iconic will give you just 1406 per month bill. So this is going to be really pleasant on your pocket as well as your mind. And this is going to be, activated only with a code again. It's my code. Just use the code. Whenever you use the code, get the discount. Remember that. Use the code always. So with all these things, I'm Dr. Rohini. Like to thank you to all those learners who have been patiently watching. And I hope you got some good knowledge about anatomy MCQs, and you'll be able to solve the questions in a jiffy. And thank you for watching. You have a very pleasant and good day.